I'm John Deffenbaugh, and I live in Glasgow, Scotland, and I'm writing a book about rediscovering America because I've been abroad for 50 years and I've come back to find out what's changed and what America's like over the last 50 years. Parents are American, formative years, got my American accent in the 60s. When I went abroad to study, it was in Scotland initially, and then stayed there, and then went to England, went out to Egypt to work, and then kind of worked my way back to England and Scotland. So I've spent best part of 50 years in Scotland. I've traveled back and forth to the States many years, probably about once a year or something on work, pleasure, holiday, and the like. And what I found is that over that period, America had moved on, and my mindset was kind of, back in the 1960s, that formative years I grew up with about, Vietnam, baseball, civil rights, moonshots. And I thought, right, I better find out what the heck is up here. So hence, kind of coming back on a series of road trips to find out about America. I kind of realized that in order to write a book, I had to do a lot of research. So speaking to family, friends, people I, meet on the street, kind of doorstep, strangers, and asking them, so look, I'm John from Scotland. I've been abroad 50 years. What's changed? What's America like right now? What's the future hold? So I had tons of research, tons of research. Well, I'm usually asking people about kind of key insights, but if you're asking me about key insights, I find a vibrancy in America. There's kind of a can-do attitude that, irrespective of the divisiveness, that is kind of a common denominator word that I'm finding through all the conversations that everybody tells me. There is still a can-do attitude. I've gone out of my way to speak to people from every socioeconomic group, geographic group, the like, and some of the people that have kind of been dealt the worst set of cards from the bottom of the deck are surprisingly the most optimistic. And some of the people that kind of got the least opportunities, like for healthcare provision, are the ones that, see, a good future for themselves. So kind of the American dream and rugged individualism kind of lives on, which kind of surprised me. I thought people would be done down a lot more, than I found. So I'd read about RAM in the UK, articles about Stan Brock and more about the international work that was being done about RAM. And I kind of clocked it because it wasn't how I'd figured healthcare was provided in the States, nor was it how healthcare would be provided in the UK. Because we have the National Health Service established since, after the Second World War, and it's free at the point of delivery. And British people don't need to think about healthcare. We don't need to think about it when we're applying for a job, when we're moving job, moving house, moving neighborhood. It's just there. It's kind of taken for granted, and it probably is sometimes taken for granted. I always knew from my time in the States, okay, I didn't think about healthcare too much then because I was on my parents' ticket or something. I knew that, kind of healthcare through the debate about the Affordable Care Act and everything, was a contentious topic, and many people were uninsured. But the offering of RAM kind of surprised me because, I hadn't thought that, that was the type of thing that would be needed. It was probably provided in the UK before the Second World War when there was no national service. But this is, the type of thing which suits America in many respects because it's kind of providing a safety net that, federal government provides a safety net, but it's not as wide and probably has bigger holes in it than necessary. So RAM is kind of the social civic society that provides that service, and being on patient registration, I heard all sorts of stories about why people are here and what their expectations are, and all extremely grateful for this service. And when I contrast that with healthcare in Scotland, healthcare in Scotland is probably about here. Healthcare in the U.S. is probably better and worse. Say, we're middling. Our outcomes, our clinical outcomes are good, not world beating. We spend about 9% of GDP on health. The U.S. spends about 18%, but the U.S. doesn't get double the health outcomes. Doesn't get that much bang for the bucks. And seeing the people here. What I wanted to do was kind of experience on the ground so I could actually hear the stories of the people here, rather than kind of read the book or see the movie or, visit with you folks. I thought, well, the only way to, kind of find out what the story was to volunteer at a RAM clinic. Well, the most common thread, obviously, why they're relying on a clinic like this is no insurance. In the UK, it's not to say it's straight shakes, because dental care in the UK is probably one of the trickier issues in medical provision because of a shortage of dentists. The remuneration for dentists on the NHS is below the level that a lot of dentists would accept in order for them to make money. And so a lot of dentists tend to take private care as opposed to NHS dental care. And therefore, a lot of people aren't getting the dental care they provide. And one of the big issues in the UK right now, healthcare-wise, is ER cases of kids with dental caries is so significant. The government is having to think about, what kind of intervention they might provide. And a couple of things they're talking about is, for instance, reduced pack size of suites and potentially mandate teachers to teach toothbrushing. So we're probably moving from a libertarian conservative to a more interventionist Labor government, so we might get some of those public health interventions. But it's probably the type of public health intervention that can be mandated nationally in the UK. Scotland is probably more Northern European kind of community-based that would take that on board than England, which is probably more, US kind of libertarian focused. I generalize here a wee bit, but that's kind of how it works. I don't think this is a party political divide issue, frankly. I mean, this doesn't strike me as something that's going to kind of get red and blue and liberal and conservative. This is great. This is a human issue. Well, from my experience of volunteering with RAM, great admiration for the mission of the organization, how it's provided, both from kind of the central support and the local coordination. Spoken to people locally, to find out, how they, provide that support. Spoken to kind of fellow volunteers about, why they're getting involved. And my general impression is that there's a passion that both the organization has and the volunteers have about why they're here. And many volunteers use the phrase kind of life-changing, and many are going pre-med, but another volunteer I worked with is economic and maths, so you get all types. I'm not clinical myself, but it's kind of an overall admiration I have for what's being done here. If this was kind of codified and rolled out more and kind of up the game, then I would think kind of healthcare in America would probably be improved further. I don't see in the current political environment any widening, of kind of the kind of privatized healthcare, public healthcare provision there is here already. The only real positive change I can see is maybe kind of a post-COVID, more zealous mission led by, influenced by people like RAM to, get initiatives like this off the ground more, because, that will both help treatment, but if it moves into prevention, then probably all the better.